Call a meeting to order. So before I get onto the agenda, I just want to explain what we're looking at doing here tonight. We have had the contract language in front of us now for several days, and what I would like to do is, our group has never had a chance, obviously because of open meeting laws, et cetera, to go over the language together. And what we would like to do, the way we have this set up, is that we are going to go into closed session immediately, discuss the contract language, figure out the things that that we like and agree on, and find those things that we feel are either not acceptable or that we need to negotiate further, and then come back here, vote on those things that we agree on to include in the language of the contract that ultimately will be in front of the council, and then focus on those things that, if there are any, that we feel that we need to revisit, okay? And we are thinking, as long as, we have Lakeview here, and perhaps Nate and John have the ability to negotiate with us without Carl, depending upon the complexity of the issues that we might have to revisit, we can try to come to a conclusion on as much as we can tonight. It might require us going back into closed session one or two times to discuss again amongst ourselves, and then come back and just try to move as much of this into the contract language as we can while we're all here tonight. Does that make sense? Mm-hmm. Everybody agree to that? Okay. With that, discussion and possible action on convening into closed session pursuant to Wisconsin Statutes 19.85 sub 1 sub E to deliberate regarding negotiating strategy in which competitive and bargaining reasons require with respect to a draft ambulance services agreement with Lakeview Memorial Hospital for emergency medical services in the city of Hudson.
Move to go in closed session.
Second.
Got a motion second to go into closed session. Roll call. Is there a roll call?
Yes, there is roll call.
Okay.
Yes.
Sorry.
It's okay.
Alderperson, no, I know your name.
Yes.
Alderperson DeZiel.
Yes.
Alderperson
Yes.
Weber.
And yes.
Mr. Mayor.
All right, motion's approved. We'll be in closed session and come back here in a little bit. So we are back in open session. The committee has had an opportunity to go through this for the first time as a group, and there's a lot that we agree on in the language. Most, I would say, we agree on. There are a couple cases where we are looking for clarification of language, and there are going to be a few instances where we're going to be looking for some changes in language that may, I don't know that there might be some fundamental changes, but I think for the most part they're not fundamental changes to language. Again, just kind of clarification. So I think, Kathy, you want to go through it with your notes?
Do you each have copies? Okay, some of them are minor. Do you mind?
You want to sit at the table?
You know what?
Yeah.
Actually, what's more comfortable for you? You want to sit at the table?
Table will probably be
Then
more
you
comfortable.
can,
Then you can both be right there.
Yeah,
and
and then
right
I
now.
can see you.
That was the idea.
So, again, some of these are just cleanup type stuff, but some is substantive. So in A,
First page.
yeah, first page, in the recitals, since we refer to health partners later on in the contract, it would be helpful to have in A, identifying Lakeview as owned by health partners. Is that a correct statement? That it's owned by health partners?
I'd probably defer to Carl for clarification on
but
that. I don't have a problem with that.
We health partners comes up later on, and we just thought it'd be good to say, okay, how do they fit in the
No,
mix?
I think there's a way to word that that's
Okay.
safe. And
then there was confusion on C. This is where Jim, you had the confusion on water operations?
Yeah,
and
yeah.
The way I explained it is you intend only to provide EMS medical services to the dive team and to rescue operations. You will be, whoever drives the boat, is it the fire department or?
Police or fire?
Yeah, will be driving the boat. You will be on the boat and you will be there solely for providing EMS services. This language is a little unclear about that, so maybe,
Yeah, when I read that, I understand, from our discussions, what your limitations were, and we're okay with that. But the fact that water rescue and water recovery keeps appearing in there is, wait a minute,
Good
you're not
point.
doing that.
Yeah.
So,
just EMS
Yeah.
support for those
on water
operations.
EMS,
Sure, and then that's called out again, 1.2 below, so.
just, there's a couple, so it just, I think we all know what you want to do, and we're all in agreement with that.
Yeah.
Just the wording seemed like, so
Clarification.
5 years from now,
Yeah.
someone going to be looking
So
for that.
Carl and I can work on that,
Yeah,
I
I think,
think.
yeah, I would agree with you on that one.
Under 1.2, we thought it might just help in the title, description of water operation EMS support. Well, actually, it's used elsewhere also,
Sure.
so we'd add that. But I think we need to, Carl and I can work on that, see.
Okay.
But we're understanding it
I
correctly,
think, yeah, I
right?
think we're on the
Okay,
same page
good.
there. It's just a matter of working through that language. Yeah.
Top of page 2, small b, the committee was concerned that a Lakeview ambulance shouldn't leave that situation till after released by the incident commander, similar to at a fire type situation.
Where was that again?
That's in small b, where if you're,
Page
there's
2.
a, page 2, small b, right at the top. If there's a public emergency requiring standbys, you're going to provide it with the understanding that you can respond to another call. And the committee felt, well, you should really be released by the incident commander before responding to another call.
So it goes down to 2.3 as well. It's small sub B, and it goes down to 2.3.
Yeah, you can do that after being released by the incident commander. Does that make sense?
Yeah, so it's that last sentence. It is understood by the parties that this crew may respond to another call and/or posting station if Lakeview Hospital's other resources are depleted. Okay.
But upon release by the incident commander, just so you're not leaving without notifying the incident commander.
Yeah, that, we would, anytime we would leave an incident, we'd always let the incident commander know.
Okay, so we'll put
just
in
change-
language to that effect.
Yeah,
Okay.
yeah.
That you would let them know, or that you would be released by? I guess that would be my only other. Let's say there's an active shooter. right,
Yeah.
Situation. In that situation, and we want an ambulance standby.
Yeah, that's a different scenario. So, where there's the potential of a life threat situation at that, we're already committed to a life threat situation. So there's not another life threat that's gonna trump that original
Oh.
life threat. So
Okay.
what we're referring to there is if we're at a fire standby and the fire department's doing a defensive attack at the fire and a life threat comes out down the street, meaning the dispatch centers, it's a cardiac arrest or, a major life threat problem, we would respond to that and another truck would respond to the fire to stand by. But if we're committed to the fire because there's firefighters inside doing an interior attack, that's different. We're kind of committed to that event.
So how do we
So,
make?
but we're talking about like a large-scale emergency, life-threatening public emergency exists or imminently going to occur. They say such as fire standbys. There's no language in that paragraph about being released by the incident commander,
Sure.
and we think there should be.
And
Yep.
Okay,
That's not a problem.
okay.
Yeah, we just wouldn't get in the ambulance and leave and not have a face-to-face with the incident commander or a radio.
Okay.
And then advise them what the plan would be, you know. We might have another truck a block away, they're coming, you know, but.
So we can put in like until released or after being
Yes.
released by the incident
Yes.
commander?
Yeah.
Okay.
Thank you.
Yeah,
Oh, 3.2, a couple clarification,
3.1,
oh,
insert anticipated
oh, yeah,
completion
well,
date.
do you have that yet, or?
Well, so there's a little bit to do with that. Until I have a signed contract, I can't even do an RFP. And our RFPs are very structured. And if you drive around Hudson right now, you notice that our contractors are busy. So the longer this
Oh,
goes,
yeah, okay.
the longer it's gonna be before I can answer that
Is
question.
that
So,
acceptable?
Yeah,
Yeah, we were just looking at.
that's totally
And that's great clarification right there.
right, yeah, we're not gonna hit the start button until we,
So we
but
don't.
that said, we have a place right now for 2 medics and an ambulance. It's my goal, I can't put it in the contract language, that before it gets too cold, we want ambulances indoors and things completed and buttoned up. But if we don't finish this till August, that's probably not gonna happen. So,
Okay, so this language is good? 3.1?
yeah.
Okay. We just delete insert anticipated completion date, Kathy.
Yeah, well, or do you delete the whole sentence? Maybe you
just
just,
the last sentence would be good.
yeah. Okay, 3.2, we needed a clarification on I am responding. One question was that app, does Lakeview mobilize, start getting going when they get the notice from I am responding?
yes,
Okay,
yes,
So wheels are rolling.
yes.
okay. And then,
Yeah, so, and that, you're on 3.2?
yeah, the question about portable radios. You said you had them and you'll be equipped with them?
Yep. We
Okay.
have 'em
And you
now.
have them now?
We have them now, they're in our possession. I think they're at the radio shop getting programmed.
Okay.
I was just thinking if we're talking about I am responding, would it make sense to put in portable radios in the, but I don't know if that's necessary in the contract
So
language.
I guess.
Kind
it's
of
what-
two different things, isn't it?
It's
I am
whatever-
responding is a dispatch thing.
Yeah, so-
Portable radios is
It's
for
more of a
convenience.
on-scene communication
Yeah.
device. We also purchase pagers too, so we do have pagers, so the crew that works here, over here has pagers. We have pagers at Lakeview in our base, but our Minnesota crews aren't carrying the pagers because once you get too far away, the pagers won't work. You know, they don't trip. So even example, when we have any calls now in St. Croix County, we get paged out for it. So the county is now paging us out, but for Somerset calls, the pager doesn't go off here in Hudson because they're shooting it on a tower up there. Now, I think Terry was saying at some point when they become simulcast, they'll go off, but currently today they don't go off, so. But here in Hudson, it goes off when we need it to go off. So it's just, again, the I am responding as a backup. It's to get the wheels rolling right away. And the pager, actually, the I am responding trips way before the pagers. I shouldn't say way before. Every call is different. It depends on how busy the county is, but.
So I'm not sure that radios, they have the equipment,
No.
it really
I feel
needs to go in
comfortable
here.
with
All right, so any change to 3.2?
Can you clarify, John, primary versus the secondary? So St. Croix County Dispatch is listed as primary, and Alina is the secondary?
Yeah, Alina's licensed as a secondary PSAP. Your county 911 centers are considered a primary PSAP, and that's nationwide, so you can't.
Can you remind me
Alina
what,
can't
can you
be-
remind me what PSAP stands for?
Public safety answering, I don't remember.
page,
Public
maybe?
safety answering point, I think.
Okay.
Yeah.
I think that's what it
They're
is.
just defined as that, right?
Yeah.
It's not anything that Lakeview does.
No.
And then it just follows that
It-
attachment where you talked about before.
Yeah,
Okay.
public safety answering point is what PSAP means. It's a national term.
Any language change to 3.2?
I don't think so.
It's something related to that, but I think we cover it later. We'll come back to it.
Just trying to figure out what we're agreeing on right now.
Yeah, I know.
So,
I'm with you. I'm with you.
no language change to 3.2? All right.
Oh, I would still love if the Lakeview could pick up the, could pick up the call and go from St. Croix County Dispatch rather than a line, but we've been through this before. I know, it's a different system, but I think that's part of your concern too, but.
But what I'm hearing is, we are. That's the.
We are, but we want a line that's still manageable.
Oh, yes.
Yeah.
Yeah, I understand it. It still plays into your system and measuring and knowing where your equipment is. And
Yep.
so it's
But,
a piece of that.
but you're picking up the call from St. Croix Dispatch.
Yeah, it sounds like we have a lot of redundancies now that we didn't have,
Yeah.
and, yeah, but we still want a line to capture that.
Are you guys getting it on the pager then from St. Croix County Dispatch?
Yep,
Okay.
yep.
But the wheels, am I right? The wheels, when do the wheels start rolling? Sorry.
Well, I'd like to say the minute the pager goes off, they're moving towards the ambulance. I mean, that's our policy.
Okay.
You know, our goal is 90 seconds to get the wheels rolling.
Well, his point is, are you waiting for a
No, no,
lineup?
absolutely not. No,
Okay.
they better not be waiting.
So either I am responding or your pager is going to
And that's-
get you moving.
Yeah, and that's always been our policy, guys. We've, years ago, we always had a Somerset pager in our quarters, because when the bridge would close, we'd always station in Somerset. And when that would happen, we had that pager there. So we've always had that. And when that pager goes off, our crews need to be moving, because we know we are the provider in Somerset, so we're going.
But
So-
I thought one of the previous meetings, and I don't remember which one, you were talking about the preference is to wait for Alina because then somehow the map gets in the vehicle,
Yeah,
the
well,
guidance system.
yeah, so what I did, how I explained that is, Alina can't assign our crew the call if they don't have it built into their CAD system. So that's why when we looked at the I am responding, and they assured us that they could put that in the Alina Dispatch Center, when they hear the I am responding, they can start building that run into the system. So our crews can go en route before we get the call. That happens all the time. If the crews are out and about and they hear an officer going on a medical call in Stillwater, they get on the radio and tell dispatch that Stillwater PD is going out on a call or a car accident at such and such, will be responding. And then when the 911 center calls them, then it gets built into the CAD. But my point was, we don't want to circumvent our current process, because that's how we track everything we do. You know, that's the money we pay for dispatching. That's all part of it. And if we circumvented that, I would lose all that data.
I have a question about the data.
Yeah.
Is that data, say you're responding via I am responding, is the response time taken from the true wheels rolling?
No,
It's from,
well,
do you know what I'm saying?
yep. So if the wheels are rolling, our dispatch will know the wheels are rolling. So even if we didn't get the call yet,
Yep.
but we get on the radio and tell dispatch we're en route, the crews hit a status button on their computer,
Got it.
and that's what logs the run in. So that's our en route time.
Got it.
So on our patient care report, it's going to be that time. So even though we call St. Croix County and say we're en route, you might have a crew that calls St. Croix County first, or you might have a crew that does it second. So they call our dispatch first. There might be a 30-second delay before they call St. Croix County. So we are always going to use our Alina data, the data that we're calling into Alina for, as our tracking mechanism. The county's data is still there, and we can always pull the county data, you know, if there's ever a question or we want to verify something. But as far as our information goes, we're going to keep our data.
Okay.
Just because I'm still a little cloudy on this, what's the difference between, you're defining the primary and the secondary. This is what I'm trying to get at. The primary is St. Croix County, and the secondary is Alina. But I'm just trying to still get at, like, how does it play out in real life?
Well,
How does what play out?
yeah,
You know what I'm trying to ask, Jim?
I'm not sure.
Primary and secondary are just, that's defined by the government
Right.
regulation.
Right.
Yeah.
That's
Okay.
not Lakeview's, we want St. Croix primary, by government regulation and statute, they're
So it's a
defined
legal-
as
it's a legal
primary.
term.
Yeah,
Right.
It's primary probably because of the patient calling
That's
that
where your
first.
911 call
yeah.
goes to.
just
here's an example that just happened when Nate and I left here and we were just driving around town, and I hear the radio all the time, so I hear things he doesn't, and he said to me, what is that call for? And I said, that's Washington County paging out Stillwater Fire for a medical call in Stillwater. And I said, our ambulance is already en route. A minute earlier, our dispatch dispatched our ambulance, but he didn't hear that, I heard it. And then he picked up on, he heard Stillwater Fire getting called to an address in Stillwater. But our truck was already en route to the call, because that's how that works. So
I'm sorry, go ahead.
9 times out of 10, through our other dispatch centers, we get the call before the primary dispatch center sends out the fire department. Here in St. Croix County, because Steve said their process is different. We're going to start everyone else first, then we'll start the ambulance. That's not how it works everywhere else. And frankly, to be honest, we should be always getting the ambulance started first. That is an industry standard throughout the United States. And I know they have a different process here, but
You good?
Yeah, I'm still a little confused as to what puts the ambulance in motion, but,
well,
The call comes in to St. Croix, so I think what I've heard Paul's frustration with this is that he's thinking that you're using Alina instead of St. Croix County first,
right.
that you're relying on Alina instead of St. Croix County dispatch.
yeah, no, well, regardless of whoever our crews hear the call from first is when they're gonna start moving.
So you could pick it
So-
up right from the,
Yeah,
From the
because we
county.
get the pager, so it's
That's
no
what I-
different than any of the other providers
Okay.
here. Again, that was our compromise. We said, okay, we'll go with the pagers.
And I think that is kind of new, correct me if I'm wrong.
Yeah,
I'm
that's
hearing that for
new.
the first time
Yeah, that's
tonight.
different.
So that's,
Well, we actually talked about that at the last meeting.
Yeah,
Yeah.
the last meeting.
I remember
we
the
said-
radios.
With Terry
I remember
Anderson,
the
when Terry
pagers.
was here, yeah,
Yeah.
so.
So they actually programmed our pagers for us, the county did.
Got it.
So we gave them the the pagers, and they programmed it for us.
so you can,
I'm here.
yeah, sorry. Well, I'm the same way, that's why it's important for me. So you could pick it up from the county is what you're saying. You could be en route, and then Alina could say, here's the call, but you're
Yeah.
already maybe en route, possibly.
Correct. And so when the wheels start rolling in the ambulance, whether our dispatch gave the crew the call or not, they're telling our dispatch, we're en route to this address. They give them the address. And then our dispatch, a lot of times, if that happens, will call the county and say, you guys have a call for Lakeview, and then they'll enter it in.
Okay.
So it's a little backwards on the process that we're used to, but we still want the ambulance rolling.
Right.
to the
Okay.
call.
Thank you.
Good.
And let me say, so the I am responding piece of that, the reason that we chose to go with that is because that is a program that can be put into our dispatch center where the paging system, we're not sure if it would actually work in St. Paul from here. You know, we don't know if it would trip them pagers from here, but we know I am responding, it's a web-based
Oh, I see.
program, so it's,
Meaning the page that goes out by St. Croix County, you don't know that you would receive it at Alina.
yeah, in
Is that what
Alena.
you're, yeah,
Correct.
I get that.
And that's
So-
where we think I am responding is a more reliable program.
So 3.2 is clarified and no language change and
Yeah.
agreed?
Yeah, as long as they can pick it up from St. Croix
Okay.
Dispatch, I'm good.
4.1, you have your operational plan now approved in Wisconsin?
Yes.
Wow.
And,
Yeah, for what we do today.
yeah,
For what
for
we do
town,
today.
yeah, okay.
It plans,
And when if this contract is approved, then you'll add Hudson.
yes. So
So can we get a copy of that operational
I
plan?
think you do have it. We sent
Okay.
it to you.
Mhm.
We
Our
have a
current
copy
one.
of it, but we don't have all the attachments.
What,
Like
you have the,
maps and things like that.
Within the document, it has highlights at everything that's attached. Policies are attached,
Oh.
following documents are attached.
yeah,
You have a big
Can you,
No problem getting you that.
you must have it electronically.
It's on the
It is,
state, yeah.
it's a huge file. In fact, the state couldn't even get it because the file
Oh.
was too big, so, because the maps are big, you know, they're GIS.
We can't
map,
email it, I
but-
can tell you that.
You can't email.
But I can,
Dropbox or
Put it
something.
in a Google Doc
I
and,
can print them,
We can do Google Docs.
yeah.
Nope.
No.
Be secure.
I can get you all that information. I mean,
Okay.
that's all, the policies are all our policies and the maps are part of our program, but, so, yeah.
Okay.
We can get
If
it.
you could get it to Devin, I guess would probably be something that we'd just have to look at here. Okay, 4.1, I don't think we had any language changes on it, so we're good on that. Performance standards. We would need clarification on response time. When does it start and when does it end?
So response time is when the ambulance is notified
And when is
to when you
that?
arrive on the scene,
And when do you consider ambulance notified?
when our dispatch gives us the call.
So it's Alina, not I am responding?
That's correct.
Okay.
Yeah. But again, so if I am responding, they receive that in the dispatch center. You heard Angie when she was here, they average 12 seconds to put a call out.
Okay,
So when they receive I am responding there, their dispatchers are, they have a performance improvement plan. Their goal is to get an ambulance on the road moving within they want to page them out within 30 seconds. They average 12. So the minute they receive I am responding in there, the plan is within 12 seconds to 30 seconds will be paged out. And then the ambulance should be rolling.
and that's when you start the clock on measuring your
Yeah,
response
the
time?
minute our pagers are tripped, they send an alert tone. That's how we measure our response. That's how all EMS services measure their response time, is when they're notified.
In the scenario when the wheels are rolling because you've gotten a page and the person in the truck is calling Alina, is it that call or is it the wheels rolling?
Well, so with our system, the sophistication of it, the crew can't just get on the radio and say we're en route. They have to be physically in the ambulance and hit a status button on the computer. So that alleviates people sitting in their quarters telling dispatch I'm en route as I tie my boots and button up my shirt and walk to the truck. They have to physically be in the truck to hit their status button, for it to be logged as being en route. That's the time.
And that's
Oh,
the data.
that's the
That's where the
time.
data's
That's
coming.
how our time is.
Well,
That's
What's our en route time?
that's en route time.
That's
two
our en route
questions.
time. Yeah,
Back
yeah.
to your question, Bill. If you're going down Highway 36 or 94 and you get a call while you're in the ambulance rolling,
Right.
either A, when that call comes to you, it starts it, or if you hit en route and call dispatch, would that not override the
Yeah, well,
dispatch call?
yeah, I was mistaken when I said that.
Yeah.
So it's when we get the call, so when our pagers are tripped,
Yep.
to the time we get on the scene, that is response time. So if it takes our crew 3 minutes to get in the ambulance and start rolling, that's gonna take away 3 minutes from our response time.
Got it.
Or add 3
Or
minutes to
add
our
it.
response
It
time.
will be measured.
It's
Part of that
measured.
response time,
And-
yeah.
okay.
All of it's measured, and that's data I look at every single day,
Got it.
every
Okay.
day.
So can we say response time is measured from when the Lakeview ambulance gets
No,
Yeah.
from-
dispatched
We
from?
received, from the time we receive the call or dispatched to the time we're on scene.
which is, receiving a call is the same as a line pushes a button. They're sending the call.
Okay.
Is that- am I
We'd like to
correct in
put that in the contract,
Yeah,
just so
So
everybody knows.
it's clear about
Yeah.
what the
So it's
measure of
defined.
response
Yeah.
time is. Just defining that.
Yeah.
So when Lakeview ambulance receives the call or is dispatched until the time the ambulance is on the scene.
yes.
Does someone press a button again when you're on the scene, or?
Yeah,
Oh, okay.
yeah.
But it's when it's received from Alina, am I right?
When,
When it's sent by.
when
line.
they receive the call, is that what you're saying?
Yeah, so where's the
Yeah.
call coming from is what I'm trying to ask.
Yeah, when the primary PSAP calls Alina, and Alina pushes the button to page us, that's when we measure our time.
So it's not, just to clarify, it's not coming from St. Croix County Dispatch, it's coming from Alina?
Yeah,
Correct.
Yep.
But again, that's no different than what you would see here today with the current provider. So if for some reason the county, and you guys have seen the times, because you've questioned the times, and Terry even talked about it, sometimes they might have the call for 5 minutes before they page it out.
Right.
And it's because there's, for whatever reason's happening there, so you can't measure the ambulance provider that time because they haven't received the call yet, so you can't fault them for not receiving the call.
No, I get that, but isn't there a lag time between the current system, which would come directly from the county,
Well,
and going from the county to Alina, then back to the Lakeview?
the way that their process that they do today, yes. And they openly admit that because they don't page us first. They page everyone else first, then they come back and page us.
No, I get that, I'm not like trying to assign any sort of blame on Lakeview, I'm just trying to
Well, no.
understand the difference in terms of how it's recorded, so that so we can kind of compare apples and apples, so to speak. So this is coming from Alina, which is going to be later than if it's coming off of the county dispatch.
Well,
Correct.
we hope to have that different in the future.
No, I know that, I understand that, and I appreciate the I am responding piece. I'm just trying to figure out the facts here. So I'm just trying to figure out what happens first. So under the current system, it would go from the county, right, to St. Croix EMS, boom, get them going. This has to go, the county, to the steps we talked about before with the
Yeah.
police and first whatever, and then to the ambulance, then to Alina, then to you guys.
But again, if you look at the other two counties that we operate in, the time is equal, and most times we're getting it beforehand. Because the process is much smoother than the other processes.
What do you mean you're getting it beforehand?
I don't know.
So let me give you, I'm in John's office the other day. Pager goes off, ambulance goes. 2 minutes later,
Yeah.
a minute later, they page out fire and first responders, law enforcement. It was the same call. Alina dispatched us to the same call first before our dispatch in Washington County even dispatched the other first responders. Because they transfer the call immediately while they're doing their other stuff. That immediate turns into our call being dispatched before the other responders are dispatched. And that's not, statistically significant when I stop in and around in the department. When I hear that often enough, it is significant. Over here, it's different.
Right, that's what I'm saying. We live over here, so we have to deal with the realities we
Right,
have.
but we also want to strive to improve health across where we provide coverage. And this is an example of where we need to go to work and get that better.
Yeah, it just concerns me.
I thought
And
it
it
was
should.
clear, and now I'm confused.
Didn't you say, though, that the county has the IM responding?
Yeah,
So they're going to hit that
Yeah.
right away before they do all their
And those are
protocol.
all examples of how that's getting better and
Yeah.
better and better.
I got an
Right,
example
that's-
today.
That was what filled that
I know,
gap.
but I've also been told by EMS folks that IM responding is not always, it doesn't always work
Well,
100% of the time. It could be delayed for whatever reason.
Do they have examples of that?
yeah.
I don't have written documentation, but if you want to talk to them, I'm sure I could hook you up with them.
So I got a call today. My IM responding app is not loading in here, but my IM responding app went off at 12:51 from the county. 12:51 and 39 seconds. It was for address on Wilford Way in Town of Hudson. We did not get paged from the county for 9 minutes later.
Wow.
Now, the I am responding came out 9 minutes before they set the pagers off to get the ambulance going.
For the county pagers, county paging to you guys with your new pagers.
Right, correct. On the same, if it was St. Croix EMS, it'd be the same. So again, not that the county did anything wrong, but when they type it in as a medical, this is what I've been told by Terry, when they type it in as a medical in their system, it triggers the I am responding app. So that comes across before they set their tones off.
So when did and that was in Town of Hudson, you said?
Yeah, so
So when did Lakeview respond?
when the pager went off, because the crew working doesn't have I am responding yet.
Oh,
So, because we have the pagers up there, we haven't set everyone's got to be loaded into the system, and I
Okay.
haven't frankly had time to do that.
But that's the plan.
That's the
To
plan.
have that.
The key
filled.
is that our dispatch have it. So
Right.
had our dispatch
Oh,
had it loaded in
So
there,
Alina
they would
could-
have had this 9 minutes before the tone went off.
Right.
And when I say 9 minutes, when our crew checked en route with the county, it was 9 minutes. It was, the 9 minutes had gone by.
so are you saying with Alina having I am responding, it can dispatch faster than the county?
Right, well,
Oh, of course.
yes, because they'll follow this, the
Yeah,
app.
okay.
Correct me if I'm wrong, I'm assuming that the 9 minutes is not necessarily an emergent phone, it's the steps of the protocol that
Right,
they
well, we
went
don't
through.
know what was going on at
Right.
I don't even know what the call, we asked the crew when we were up there, but I think there might have been some question whether the person wanted an ambulance or not. So they're working through that process, but because they triggered it as a medical call, it's triggered the I am responding. So I just using that as an example of, there could be delays, but there could be very good reasons why it's being delayed.
So can we define response time when Lakeview Ambulance receives the call or is dispatched by Alina until the time the ambulance arrives on the scene? Is that accurate?
Yes.
Okay. And we'll probably put that in that 5.1, and I could go over it with
Yeah.
Carl.
Yeah. Yep.
Okay.
And I would invite any of you guys to, we could set up a time and you can go sit in a line of dispatch and see how it operates. And I'm sure Terry would, I shouldn't speak for Terry, but I know they let guests come in there sometimes and sit and watch the process, and you see the process. I think it gives you a good understanding of how it operates.
It sounds like we're talking about the way it is today, and it isn't quite connecting the way we want it to yet. The I am responding is, when that was the piece that kind of sold me. That I am responding is going to resolve that issue of the 1 to 2 minute gap.
It will,
We always talk about cell phone. They
Yeah.
gotta pick up a cell phone and call Alina, and 1 to 2 minutes sometimes, 30 seconds, 15. Now, I've seen looked at the data, it's all
Yes.
over the place.
Right.
Right.
Up to 2 minutes before that contact seems to be made, recorded anyway.
Sure.
So,
yeah, everyone that I know, a couple of our staff are on Somerset Fire. They all have I am responding. They say they get their I am responding before their pager goes off from the county. So again, Terry explained that because the way it gets typed up in the system is what triggers that.
yeah, but it's a notification, but not information. That doesn't really tell them what's going on,
Oh, it does.
other than it's a
Yeah. I mean, you-
location.
I'm just showing you.
Yeah, I'm not remembering that meeting. Okay.
So it gives
So you
you,
were able to do
You're
who's
starting to go
rolling.
that way, yeah.
yeah, I mean, it'll even map you to the call if you want to just hit the map button and it'll take you right to the call too.
What
Which
what
we
more do we
already
need to
have.
do to make sure to get everything moving forward? Is there anything that we need to do? Do we need to work with St. Croix County?
I think we have that ball rolling, is
I
that?
think we do too. I
Yeah.
think, I think there's a learning curve on both sides right now. There definitely was for our crews, because we don't call into the primary PSAP, and we're doing that now, and their process is different than what we're used to in all the other counties. And again, we want to be a good partner to them, and we want to provide the best service that this community can have. And that's our goal, and that's what we're going to do.
Organizers have to navigate the waters.
Right.
So 5.1, we got response time clarified in that definition, and we'll put it in there. And based on that, is the committee, nothing more, no,
No other
other
points
than the
about that.
definition, just add that, okay. 6.1, I think we were.
6.1,
okay.
we're good. 6.2, we go down to item B.
The committee wondered, do you mean increase in mutual aid usage rate of, or what do you mean by of 5% or more? Is it to 5% or 5% of your past 3 months average rate, or what is it?
We've got into
5%,
grammar.
a 5% increase in 3 months.
For the last 3 consecutive months?
Increase to
Right.
5%.
As compared over the previous, or just within that 3-month period?
Of our total volume.
Of our total volume.
Total volume.
For the year, or?
Well, we can look at it
You
either
do-
way,
You do it
but,
by month.
Yeah.
I mean, it's,
Right
for
now.
easy math, if you have 100 calls,
Yeah, right now,
5% is 5.
you're about 2%. That's
right
the number
now,
we talked about.
today, we're just a little bit
So-
under 2%.
So if it goes to 5%, is that the number you're looking for?
If it increases by 5, so if it goes to 7, that's how I'm reading this.
So, well, go ahead, Jim.
That's another number.
There's a different way of looking at this, and Jim defined it pretty well. So a 5% increase of 2%, it could be, what'd you say, 2.1%?
2.1%, which I know is
We
ridiculous.
figured that you meant no,
I don't think any ambulance service in the world would react at a 2.1%.
No, we knew that.
It's just a
You guys-
language, it's just an English thing.
Actually,
it's a matter of just one word.
What?
of
What do
or
we
to?
change
Of
it
to
to?
2,
Yeah.
Or plus.
or plus 5%.
Are you
now we got another
comfortable
one.
with 5%?
Increase
I'm
it,
comfortable to 5%.
We don't want, I mean, what do you guys hold your?
We know exactly what you want.
Okay.
but-
We
but
agree
it's
with you.
just-
We
Yeah.
just want to
But it's
clarify
just
for
not
the language.
worded that way.
Yeah.
Right.
So, you know what,
We're engineering. it
Change of
because
to
we don't wanna
to?
be engineering.
not
or
understanding this.
something that's more,
You're not in.
I
Not
think
to
that
exceed-
Carl's looking
not
over
Not to
the-
exceed.
Not to exceed 5% of our annual call volume.
Okay,
yeah, there you go.
thank you.
And then that change also on the Wisconsin area, Kathy.
Yeah, and the committee would like it changed to the Wisconsin EMS service area, not the entire Lakeview service area. In that 6.2B.
How would you divide out the numbers?
Well, I'm just trying to,
The reasoning is just that if we, as we grow, let's say,
Yeah.
and more mutual aids coming in on our side, it might not be registering as much on the Minnesota side, for example. So then it would tell us we need an extra, at some point, ambulance in this area. But the numbers could be kind of skewed by the Minnesota side. So what we're trying to do is just make sure that it makes sense for the local area here.
If it's 3% on the Minnesota side, but it's 7% here, and it washes out to be, or whatever that math
well,
is.
yeah.
I see what you're
I mean, I just look at it now in our annual, like last year, we had 7,139, and we were just, I think, under 2% or 2.1%. I don't remember exactly, but let me just see.
What was your reaction point for your own service for mutual aid? Did you, when it gets to a certain percent, did you?
That's a good question. I asked that myself. We didn't really have one because we've had obviously having a hard time just staffing what we've got.
Right, I mean, if you were giving away 15% of your calls, and we're looking at 5, I mean, that's quite a disparate spread there, but,
They'd just like it to reflect what's going on in this area.
right,
And not be skewed by what's going on in Minnesota, because
sure.
if you look at this area, it may require an additional ambulance or something.
So we'd have to break out how many
We've got
calls we gave
more
away in.
growth going on probably than in Minnesota.
This
So you would just, your interest would be more in the city volume?
Well, no, we're saying the
Service area.
Wisconsin, assuming Village of North Hudson, Town of Hudson,
Yeah.
and the portion of Troy.
So I don't even
The
know what
contract.
that volume is. So
Up
it's hard to put a
2,000.
percentage on
Sure.
it.
Oh,
Around-
just
Around 2,000.
Yeah,
the
that's
volume of your mutual,
No, the call volume, I don't know what to anticipate for the call volume.
that's too,
You know, I've heard 1,800, I've heard 2,100, so,
It's
If
been
I
as
just
high as
do-
2 that I'm aware of.
That's counting transfers though.
Probably. Yeah. I can't be clear about that.
yeah,
either.
Well, the
Do you wanna
projections the
think
city,
on it,
the
or-
projections the city finance person did were 1,142 billable calls or something, looking at projecting in the future for the,
for say Croy EMS.
For the city.
that was without Town of Hudson.
Are you
without
comfortable with
transfers.
5%?
It's around 1,500, I think, historically, if you have those.
105?
You're right.
right?
So with the engineer, 105 calls?
Is it, so
If you went
fi-
2,000,
if we do 20, if there's 2,100 calls annually in this area, 5% of that's 105, right?
Mhm.
We're not gonna do 105 mutual aid calls. So I'm comfortable with that.
Oh, well, then maybe,
We gave away 133 calls last year.
All right, so
Again, and that's 7,000 some calls. So,
we're good with that 5%.
right,
All right.
we're not.
Anything else?
or
Good.
what about the service area?
The
Does it make a
Wisconsin side.
difference?
Oh,
I'm just talking.
He's talking about the Wisconsin
We
side.
look at,
Then-
if I look at your numbers here, yes, I'm comfortable with that.
Okay. So-
5% of the Wisconsin Lakeview EMS service area.
So when you say that, are we
you're
saying
never gonna get
Somerset and
that.
St. Joe's too?
Yeah, that's a good point.
No, this
Is it
is our
the-
contract for just us and
Yeah,
our service
okay.
area and our
Yeah,
municipal partners.
right.
Under
And that's
those
where-
entities covered by this contract.
Yeah.
Right.
Okay, go.
Yeah, we'll probably put that in the definition once we
potentially
know
covered by the
who it
contract.
is.
Yeah.
Sure.
Because we
That's up
don't,
to you
yeah,
guys.
Yeah.
yeah.
So the other point about that is separating that out. If you're over 5% for your overall, where would you place that additional asset? You know, on the Wisconsin side or on the Minnesota side? Where is that coming from? You know what I mean?
Right.
Well, in the committee,
Rhetorical.
Yes. You don't have to answer that.
designed to address stuff going on here. Okay, so that's changes, good.
Yep, yep.
C, right?
C, we need a definition for unit hour utilization.
All right, we'll get you one.
Okay,
And I guess the other question is
I'm not gonna write it.
how are you measuring the UHU? So, give you an example, like if a truck is going to do an interfacility to Regions, that trip to Regions, is that part of the utilization, or is the trip back also part of utilization?
Any transport, any movement of your fleet is your unit utilization hours.
Gotcha.
So what you do is you take your, if I have, well, I'll do it really simple. If we have 2 ambulances staffed 24 hours a day, and that's the normal staffing, you take your normal staffing and you, that would be 48 hours divided by the number of calls that you do.
Right?
Get your unit utilization hours.
So number of calls is not
Not
distance.
the amount of time that it's being utilized in those calls? You know what I'm
Well,
asking?
it does take that into account. If that ambulance is gone for 2 hours and your other trucks are doing calls, that, that's gonna increase your unit utilization hours.
Gotcha.
So the industry, it starts at 0, and there is some formulas out there. I have a document I could share with you, but ideally you want to be about 0.2 to, I don't think it hits 3, but that's the midpoint. And that is good utilization. You're not burning your crews out. You're covering most of your calls. When you get up into the upper 3s, 0.35 and higher, you're starting to put more stress on your crews. However, as an operation, you want to have the higher the number, the better utilization you are
Right.
doing, so.
Take productive man hours that we've used in
Exactly right,
operations
yeah.
for years, productive man hours per stat.
It was just another way, and that was actually Dr. Peterson that came up with that idea, that's another way of measuring, I think there was some concern here that our trucks are always out on the road and the crews never get any downtime, and that was kind of what he picked up on some of the meetings. I don't want to speak for him, but he said, let's just show unit utilization hours. There is an industry standard out there. And so it's just another way for you guys to see the measurement of usage of those vehicles and what they're
So
doing.
you want a
You'll get a
definition?
definition, yep,
Yep.
and we'll insert it.
Okay.
Okay.
Can you give us some data recent data on your unit hour utilization?
Yeah, we're at 2.2, it depends on so you can measure it either by week, annually, but when I do annual, we're at 0.24, I think, right now,
Okay.
annually.
And how much does it vary week to week?
I rarely see any variance. Now, I will say, a week and a half ago, we hit 0.3 on the overnight. So between 11 o'clock at night and 7 o'clock in the morning, we hit .3. That's the first time I've seen .3, but we did 10 calls in the overnight.
So that's just
So-
for one shift?
That was just one shift. And I do that, I routinely, every day, I look at our data, and I just, quickly run the numbers and see, because when the crews say to me, oh, man, we were really busy last night, and then I can show them the numbers,
But in terms of the contract, how would you calculate this? I mean, would it be a monthly utilization number? Is that how
Well-
you're going to be calculating it? And, we need to define everything, how it's going to be calculated in the contract.
It'd have to be monthly.
Yeah, I don't know.
We're gonna be asking future people, not in this room, to evaluate, sit on that committee.
You may want to, Sarah, you may want to
Okay,
get
come
there so
on.
you're on the mic.
Another.
Oh, is this one working? So just for the future people who are going to be evaluating the success of our contract and of your service, we need it really easy, because we're going to be putting laymen on this committee for people that don't understand the calculation. So maybe it's an attachment that defines the calculation for both B and C. I'm still unclear of what you meant with the 3 consecutive months, if it's 5% each month, or if it's a rolling average of those 3 months, and what we're comparing it to the baseline. So just something that will explain to future people who are evaluating the success of these criteria. So a undergraduate could understand how to evaluate it.
Yeah, and I think the reason you do the 3 consecutive months is, what if you had a bus crash on the
Sure.
interstate and you needed 60 ambulances? That, in that month, we would exceed our 5% in mutual aid response. Are we going to react to that? Or if you do a 3-month run. Same with your utilization hours. If something happens and all of a sudden we spike, the Gopher to Badger Marathon, it's hot that day and we do call after call after call and we spike but next month we're back to normal. That's
Right. Just, I think anything that makes it very simple for
Yeah.
a person 10 years down the road or 5 years down the road, whatever, is evaluating, that they understand the calculation and how
Yeah.
how you arose to it. That's all.
And
Yeah.
for the unit hour utilization, are you going to be doing something before it gets to .5? Is .5 too high to put in the contract? Should it be lower? It sounds, because you're saying that it's about .25 to .3 most
Well,
of the
I would
time.
offer that we don't ever look at one single metric and
Right.
react. I don't know how that correlates to your world, but you can't look at one number and make a reaction off that. That's why we put several in there, and I can also offer that that's probably just a starting point. We look at a
That
lot
could be
of
further
things.
defined by that
Parameters,
committee.
you mean.
Yeah, yeah.
advisor.
Okay.
That's risky to just use one thing to base your decision off of. So in our answer, we look at those numbers every day as a barometer. But rarely does John react, especially to me, about, well, we hit .3 today.
I don't think that's what any of us are asking for. We just want it clearly defined so that a future person could understand
Yeah, we
what
can
this
get-
is.
Yeah,
That's all.
I think
We'll
we can
get you a
agree to that.
definition on that.
We'll get
we
the
can
definition on that.
definition on that.
Given what you said, but perhaps we need to say, are not limited to these 3 metrics.
It could be, and that may come up down here further. It is over here, if you go to page 5, but we're jumping
Yeah, the
ahead.
things those are the things that the committee looks at. But here,
Right.
these are kind of like, this is saying, hey, you really need to be strongly thinking about action. I'd just like to say, not limited to these, because I know you'll look at each one of these and say, why did this occur?
Right.
And evaluates, it becomes situational, these numbers are situational.
Yeah, I'm fine with that. I
No,
don't know
that's
if that's-
fine.
changing
Yep,
that?
I've got it in there.
Yep,
At,
okay.
I don't want to see it pinned
On-
down to,
in
now
the-
we have to do something.
First sentence of 6.2, include but
It
not
doesn't make
limited to.
sense.
Yeah, and those can change as you know.
Okay,
New data comes out.
All right,
Great.
Yeah.
Number seven, or,
7.1, we
Yeah.
had no changes, did we?
no, 7.2, I don't see anything.
No. Oh, 8.1, first responders, you say any and all first responder groups, does that include police and fire?
Yes.
Yep. Can we define that can we just add that, including police department?
I would say that's up to you.
Yeah.
Okay.
Including police and fire, okay.
8.2, we had,
Well, there were several things, I think you were talking about training, weren't you, Bill,
So,
on CPR?
medical supplies.
Yeah, so, well, the first thing is on the police side of things. I just wanted to make sure that some of the training that they're receiving, that is within the scope of what we're talking about with first responders. It's the CPR resuscitation training, the AED resuscitation training,
Yep.
or I'm sorry, CPR recertification, and then the basic first aid reviews. And is that worth defining in this paragraph as part of the
Is
training?
that included in your training?
Yeah, the only thing that we can't do because the state of Wisconsin regulations that they have is we can't do an EMR training over
Sure.
here. We can't do EMT training because to do that, you got to be licensed as a college. And we're not in the business to do that, so we're not going to go through that accreditation to do that. But for continuing education, your basic CPR, AED training, Narcan training,
Right.
all of those things that aren't the formalized licensure of the state of Wisconsin, we provide that training for our law enforcement and first responders today.
The next question is can we include on, so we say disposable medical supplies as needed or replacement of, can we add replacement of Narcan? Currently, police officers are replenished through St. Croix EMS.
Yes.
Okay.
Cool.
And that's all at no charge, right?
That's correct. We don't.
Okay.
We
So
don't
what
go
we were
back.
wondering is on
But add at no charge on
8.1, 8.2, 8.3, 8.4, wondering if we could change that to 8.1 with the other paragraphs being subsets of that, so that the at no charge kind of covers those three,
It would really only need to be the first
Yeah.
one.
Right.
only the first one as a
Yeah.
subset. Is that,
And 8.1, you mean?
Yeah, that,
The
the,
8.2.
You know,
a 1 point,
A.
yeah, A.
just to make it clear, that's at no charge. Or we could add at no charge, either way. Are we good?
Yeah, we do that at no charge.
Yeah.
Yeah,
Yeah.
okay.
The reason I hesitated on that, and that's maybe something I just need to talk to Carl about too, and make sure Kathy's in agreement. I just want to be careful on, some of the, like epinephrine. So, some first responders can administer epinephrine, but an EpiPen is over $600, and we're not going to purchase an EpiPen, for that. The Narcan, like in Minnesota, we have trained hundreds and hundreds of law enforcement officers, and we're supplying them with the Narcan. But the state of Minnesota gives us some grant money on it too. So we'll just want to make sure that, I need to talk to our pharmacy about it, to make sure that we're okay to do that.
Oh, with
Here, right?
Narcan?
Yeah.
Okay,
I mean, I think we're okay, but
Yeah.
I just don't want to say right out, yes.
Sure.
I need to just clarify
Yes,
that with
that's fine.
Carl and with Cindy, and
And we have had first responder groups ask for epi, right?
not over here, we haven't. We've talked about it,
okay, so
so,
you'll confirm that.
yeah, we have no issue doing it. I just want to make sure that, first of all, we got to make sure Well, we know the state's okay with it on the law enforcement side because they're doing it today. Okay. I don't think it's going to be an issue.
And then, I think that was it on 8.2. Is that what you had too, Kathy? Is there anything else? Because there was 8.4.
8.4, we were wondering if, for example, a police officer is trained and certified as a paramedic, as if he's responding as a first responder with the police department, can he work up to his certification, or is he limited to the first responder certification?
So they probably, the answer technically is no,
Okay,
because they don't have their equipment with them. And they're not,
yeah,
as being a law enforcement officer, they're not calling medical control. You know, they're not in contact with a physician to do certain procedures, and they don't carry the equipment. So they don't have a cardiac monitor, so they can't be administering medications because you don't have the monitor to verify what you're given. So we do have paramedics that work as first responders in both St. Joe's and Somerset, including one of my full-time paramedics. They operate as a first responder.
within the only the first
Scope of
responder,
practice for
okay,
the-
yep.
But they're not able to go up to paramedic scope of practice?
No, because they don't have the equipment to do that. You could, I mean, they could, because they're licensed in the state to do that, but they don't have a cardiac monitor with them, the medication,
Understood.
so you wouldn't never get to that level.
They're not equipped to do it when they're in their
That's
police.
correct.
But aren't there certain things, I mean, that they could do if they had the access to it?
If they had if they had certain things, they could do it, yeah,
Could they?
But is that's governed by state
Yep.
regulation,
Yep.
not by contract?
right. That's all in the scope of practice and
So
and
we
the
aren't
license
in
of the
charge of
service.
that.
In my understanding, wouldn't it be the Lakeview EMS medical director that would make those decisions in terms of what, like, the
You-
first responders could do, or if there's limitations on them?
It still has to be within the guidelines of the state.
Okay.
Yeah.
Would it be perhaps a little different example? If you have a first responder who's also a paramedic, would they, for example, perhaps ride along in the ambulance and act as a paramedic under, is that a permissible?
So we do that too. Actually, we have two paramedics on Somerset Fire that work for us. And if they are first responders with Somerset Fire and we need an extra set of hands, they'll go with us. And yes, they can function, but now they're our employee. They're no longer under the
So switch.
liability of Somerset Fire. Once they get in our ambulance, they're now our employee
Okay.
again, even though they're not scheduled.
I know there are several paramedics who work for other services.
I know.
Who would be interested in being part of the
Yeah.
first responder system here. And that would be one of the opportunities, where they could provide service. Is that permissible? Are they going to be, I guess the question is, are they going to be operating at, this little first responder box, or when the situation is correct and they have the equipment and the guidance?
If they have the equipment to operate and a medical director that gives them the approval to operate that way, and they have the license to do it,
And that would
I
be-
have no problem with them.
And that would be in this case, your medical director. So-
I think it's pretty clear. I think the language is clear with the clarification that it's as long as it's within the scope of the Wisconsin statutes. They can work up to their certification as long as,
Yeah.
Consistent
Right.
with the requirements of
Yeah.
Wisconsin.
I guess
So-
my question was more on a liability standpoint.
So if let's just use the police department as an example, because that's the first thing that came up. If it's a police officer who is a paramedic and, works somewhere else, doesn't work for Lakeview, they can't operate with Lakeview or with that police department unless their current medical director gives them the authority to operate that way
Right.
in that system. So
Okay.
one of my medics can't go somewhere else and operate as a paramedic without our medical director giving them the approval to do that. Because you technically are working under the
Direction.
license of the medical.
All right, so do we need any change to 8.4?
No,
I'm not hearing
Okay.
any.
no.
No?
Thank you for the clarifications.
Yeah.
All right, so next, we're good with 9, 9.1, A, B, and C, 10, 10.1, 11. Anything with 11.1?
Yeah, we're just gonna, I mean, this is cleanup in a little, appointed by each additional participating municipality, about 4 lines in. And then, we'd like to change, and this really just pertains to the city, this is about appointment to the performance
Right.
review committee, that it'll be appointed by the mayor. Well, I think we'll just, would put in some language that the rules for appointing and removing the representative will be made by the city, procedures, instead of having.
Each respective
Yeah, each
municipality.
respective municipality.
Or.
So if we have the
contract.
mayor appoint, subject to council approval and council removal.
We got
it's-
it.
We decide that, and we'll just say each municipality
Trust that you
makes.
can work with Carl on that one.
Yeah, yeah, because it doesn't
Great
affect
idea.
you.
Okay, 11.2, we do have some,
Excuse me, I'm sorry, Mr. Mayor. On 11.1, we were also talking about adding a member that is a
Oh, that's
non-voting- non-voting.
Oh, yeah.
Yeah, adding someone from dispatch, St. Croix County Dispatch, as a non-voting member, but to provide information, and,
Thank you.
so that's okay. Thanks, Bill.
11.2, wanted clarification on community partners. We were thinking you meant municipalities on this, but,
Third line down on the top of page 5.
oh, I'm sorry, yeah, page 5.
Yeah, I think that's what that is.
So we can make a correction there.
Reports to the committee, the common council, Hudson Hospital Board, community partners is, yeah, I think that's
Additional
referring to.
municipalities
additional-
participating.
Yeah,
The
I
addition.
can verify with.
yeah.
Not the Chamber of Commerce or the Park Board or the,
No,
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 no, no.
No,
The why.
Although we're good with that too, if you,
okay?
Committee suggested, it says at least quarterly, they said, thought for the first 6 months.
First 6
It
months or
might
first year,
need
I
to
mean,
be
we have this
monthly.
expectation probably about doing monthly meetings. I don't know that it needs to change in the contract. We just wanted to be open about,
in the town of Hudson, we said quarterly, and I've been to every meeting, to every monthly meeting.
well, Bill, that would be 3 meetings less a month for us now at this pace.
So you're good with that?
Sorry.
You want to change it, or are we, okay?
no, I just wanted to be
Yeah.
upfront
Yeah,
that
no.
that's
Right.
kind of what our expectation is.
Yeah.
I don't think it has to change contractually, it just,
Yeah,
we wanted to let you know.
it says at least quarterly, so we.
That makes perfect
gives us
sense.
some- And then
Just kidding, Bill.
in the listing of things, add rate increases to patients and changes to the low-income insured policy as considerations for the committee, isn't that what, yeah,
Yeah.
as things the committee can receive information on and consider. So that would be added as H, and
Any
then-
problems there?
Okay, so say that again slower, Kathy, please.
Rate
Rate increase.
increases to patients. Well, do you use the term users or patients when you're talking about people actually using the end user?
Patience is fine.
Okay. And any changes to its health partners, low income and uninsured policy? I mean, that kind of goes along with rate increases. If there's changes to those policies, our committee is,
Any issues?
I don't have any, and we'll of
Okay.
course run this by Carl. I don't think,
I do
we actually
have-
include the link to our policy back here in 13, right?
Yeah, that was kind of that's coming up.
Yeah. I'm jumping ahead.
I'm also wondering if it would make sense to have the unit hour utilization in that defined, that would be something that we would look at as a committee,
well,
or no? I mean, I know that's covered in a different,
Yeah.
In the committee for the,
in the advisory committee.
well, I
Well,
think,
any of those performance standards.
yeah, that's what we would talk about in those committees that,
Right. I mean, I just saw that it was
Yeah.
response times.
Yeah, so you're talking about
Mutual aid,
those
just-
things under 6.2 would also be included in there.
Yeah.
I think
And we
that,
define A and B
There
from
you go.
that, but.
you could even
not C.
call back to 6.2,
Yep.
right?
Yeah,
All right.
you
Perfect.
can.
Thank you.
What's next, Kathy? Nothing on
Oh,
3, 4.
11.3, they, instead of the word, and I can, necessary, this is on records, just any records the municipality requests to review, or the committee requests to review, instead of who makes the decision on necessary. That was the sticking point. So if they ask for records relating to EMS, they'd like it to be provided.
So what's the correction?
So it's get rid of, let's see, to the extent that Lakeview will provide the committee with all data records provided by Lakeview in the city of Hudson that the committee asks to review.
is, as long as it doesn't pertain to any HIPAA.
Oh, yeah, that's, yeah, right, those limitations
Yeah.
are,
And that's called out below, so that's good.
Yeah.
Right.
okay,
That's
yep,
fine, Kathy.
okay, good. I think that's it on
Page
that
5.
page. 1104 is okay, 1105, 1106, 1107, 1108, 12.1,
Back on, are you talking, what page are you on?
We're on 6.
6,
At where? 12.3?
12.3.
Not, well, yeah, we are now, yeah.
That, I know we struggled with that. We're not there yet, I'm sorry. With that whole dedicated coverage is unclear, and I can't give you language. Am I right? I mean, isn't that the consensus of the
I
committee?
think we've rewritten that one
I know.
I
50
know I
times, so.
have.
yeah.
I know I'm not real good at explaining stuff in writing. What, how can I,
Well, one question, let's start with this. One question that Paul had is if you're required to be at a football game,
Yep.
can you actually leave before another ambulance comes? I mean, is that within the law?
you're the attorney and you tell me, but, and I'm
I
not
don't
being
know.
sarcastic by saying that, but look at, across the state of Wisconsin, there's many communities that only have one ambulance service.
Mm-hmm.
And some maybe miles and miles away before the next town. If someone, little Tommy, gets hurt at the football game and needs to go to the hospital, what are they gonna do? I mean,
I'm just asking if you,
I
I can call Ray Lemke, I mean, I
yeah,
don't know, I don't
know
get
what
into the details
I don't
of,
know what
it's
the
just,
rule is on that, but I know in our operation what we do because we have the ability to backfill that ambulance.
Mm-hmm.
So the minute that crew that's dedicated to an event has something that happens there, they call another crew in to do it.
okay.
So we dedicated a crew to the soccer tournament this weekend out in the town of Hudson at the Field of Dreams. So the plan was you get anyone that's hurt, you start another ambulance over there to backfill for you guys if you go out. So that's how we
That's-
always do it. That's just our
Yeah.
normal practice when we have a dedicated cover. We had 6 ambulances on this weekend because we had a high school rodeo in Washington County Fairgrounds the whole weekend. That was required to be dedicated or the rodeo has to stop. So it was the same deal.
Okay.
They know that if someone gets hurt at the rodeo and that ambulance needs to leave, they have to wait till another ambulance gets there to backfill that.
Right.
So it could be the same in the state of Wisconsin. What we do at Somerset is anytime we're at Somerset High School game, Somerset Fire Department is there with, we don't ask them to do it, but they're there all the time. They have EMTs and they have the ability to backboard, and I think that's one of the key requirements is to be able to backboard someone if they get hurt.
Okay.
So we kind of have a backup plan in Somerset. I'm not saying that that's what we would do in Hudson, but remember, anytime we have those dedicated events, our goal is to always staff an extra truck. So we would still have 2 ambulances
Right.
here in town and 1 at the high school game.
Right.
Okay.
And that helps, and I appreciate the extra ambulance, I think that's awesome for Hudson. The point I was just needing clarification on is, there's like point I and then there's like point double I. And we were trying to, as we were talking through this, we were trying to figure out, okay, so if there's let's say there's an extra ambulance at the football game, right?
Yep.
And then 2 blocks away, there's a 911 call for a heart attack or whatever. Does the ambulance from the football game go there, and then does it get backfilled from, like, one coming out from the hospital?
Yeah.
That's what I'm trying to figure out.
Again, an example of this weekend, we dedicated a crew to the soccer game at the soccer thing that was supposed to be over Friday night at 8 o'clock. At 7:45, St. Croix County assigned that ambulance a call in the township because they were the closest ambulance.
Right.
And our crews knew that that could happen. So the crew at Hudson Hospital just went to the soccer tournament. People at the soccer tournament didn't even know that happened.
Right.
But, so that's how you would do it. Again, that wasn't considered a life threat call, but the event was almost over and the trucks were available, so.
Right, and the way when we were in closed session, we were trying to figure out if I was different than double I, but it sounds like it's the same in terms of the
I
procedure.
have 2
too.
double I's. Do you have
I have
2
2
double
double
I's?
I's too.
Okay, good.
12.3 double I, 12.3 B
double
double
I.
I.
So we're just trying to figure out if so the I and the double I are treated the same, is what I'm hearing. Is that correct? In other words, if there
Yeah.
was a life threat event, the ambulance goes, and then you backfill it with another one. We didn't know if there was you were trying to distinguish between the I as dedicated, it stays, and the double I is, it's backfilled. But from what you just told me, I'm gathering that they would be treated similar.
I think the difference there is the for-profit, unless you're reading in a different section than I am, the for-profit versus the regular.
Request of a for-profit.
It's just that we would be charging a for-profit.
Yeah.
I think that's,
Right, but I think your point is the backup ambulance will leave the event, starting at that sentence,
Yes.
covers both I and double I.
yeah,
Yes.
Yes.
yeah.
That's what
Gotcha.
we're trying to
And
get.
so we didn't know if that was just to double I and not to I?
Oh, okay, you're done.
So no language change there.
Yeah.
Well, I think we should spell it that the backup, I think it should spell that out.
That
On the
that
event
it's about
promoter?
I and double I.
Yeah, that procedure can happen at both things.
Okay.
And maybe we need to check, and Kathy, that's a good question.
I'll-
Wisconsin state law, because I don't know what the law is on that, if that's ambulance can leave. I don't know if it's supposed to be dedicated.
I would
And-
guess
and honestly, I don't
the
know either. We-
reality probably
Gotcha.
prevails.
The request has always come from the high school, and we've just always met their request.
Yeah.
So if an ambulance would leave the high school football game out here with a patient, do they stop the game till the next ambulance shows up?
That's a good question.
I don't know.
I don't think they do.
Doubt it.
No, I don't think they,
No.
I wouldn't think they do.
No, I don't think they do.
But we should research
I
that, I think. yeah.
can contact Ray Lemke at
Okay.
but he goes all over the state and understands that.
All right,
there's a lot of
so
minimal-
12.3A, there's no change in language? Is
No,
that right?
B
There is
needs,
in B.
yeah,
How are we doing on C?
I had that as okay,
C
D,
and D are fine, right?
Yeah, they're fine, yeah.
okay.
page 7?
Before we get on to page 7, the dedicated and non-dedicated standby, I just would like to see a little bit more clear, you're talking about dedicated and non-dedicated standby, that's not about a life threat emergency or anything, it's about events,
Yeah.
right? And then earlier on, we were talking about dedicated standby for events, or for life threat emergencies or whatever. Just wondering if that, adding
So
that
he
to
would
the
like that
title.
in the title, in
Yeah.
12.3. Dedicated and non-dedicated standby coverage for events.
For events.
Okay.
So,
Yep, that's
Moving on.
good. getting easier and easier.
Maybe I just, complicated it because I went too much into detail. I mean, there's.
No, this came up in the other meeting.
Okay,
so
all right.
Yeah.
it's not a problem.
Well, yeah.
12.4, I think we're good.
Yeah.
12.5, we're good. 13.1, we're good.
Yep.
13.2, we're good.
No.
No?
We wanted to have that, and you handed it out, but I don't know if I have a copy of that policy just attached.
And we, we want to put that link in the contract? That was a question that Carl said.
Yes.
Does it make sense to put that link or just?
Oh, in the contract.
Yeah. Where to find that?
Yeah, let's just have it as an attachment.
Yeah,
That's up to you guys.
Yeah.
I think that makes sense. 'cause
Okay,
the link could
It's a
change.
paper copy, you're not going to link anyway,
Right.
right?
right. And then we wanted,
So what does that mean? We're,
it's attached as Exhibit A. Instead of the following link, we say attached as Exhibit, whatever it is.
Do you, and
But
that would be
then-
a question to legal, do you feel comfortable if you change that policy within the next 10 years?
Well, and that's the beauty of an attachment. You don't have to redo the whole contract, right? For the attachment?
Right.
Pardon?
You wouldn't have to redo the entire contract if it's an attachment. So it's referring to that, because that can change every year.
Yes.
That policy can
That's-
change?
yeah.
And that's what, yeah, because he says it's the current,
Right.
it's a copy of the current policy. But, and we put this already in the committee.
Right. Yep.
We'd like to have notification of if that,
Change.
if that changes and have it come up at the committee.
Right? Yeah.
So I'll put language into that effect.
okay, Jim on 14. Choice.
Yeah. Had some, because I've gotten some comments about this particular issue, probably more than anything. One is, when you're treating a patient, here it says, patients requesting transport, how are they advised, or do you say, do you want to go, or do you say you should go, or, you know, this puts a
Oh,
lot
so
of
if I'm-
onus on the patient. the
If
way
I'm a
this-
patient and I say I want to go to Regions or I want to go to United, how does that conversation get facilitated? Is that what you're asking?
Right, yeah, how do you,
Is that?
Well, so,
how would you speak to a person?
yeah, there's a number of different factors that go into it, but, let's just say it's, someone who's fallen and they have hip pain, but they're saying they don't, I don't really think I need to go to the hospital, and the paramedics do their evaluation. So the patient needs to have, informed consent. So the medics need to explain to them, you're having pain there in the hip, your hip could be broke, we can't tell that. The only way to tell it's broke is if you have an x-ray done, so you really need to go to the hospital and have that evaluated. It's still the patient's choice whether they get transported or not, but we need to inform them of the consequences. If you don't go, this is what could happen.
So what if I'm in the ambulance and I say I don't want to go to Hudson Hospital, I want to go to Lakeview?
Then we'll take you to where you want to go.
But how does that get facilitated by the medic or me as the patient?
Well, the patient has, and that's in the contract too, is the patient has the right to choose where they go within reason. So we have within the Metro 694, 494 loop, we have no quorums of taking anyone within that ring. We'll go outside the ring if we're not extremely busy, if we have all the trucks available. We'll always try and talk the patient into going to the closest facility, because that's what we're required to do by CMS rules, is the patient should go to the closest facility that's appropriate for their condition.
Who defines that appropriate for their condition? Does the paramedic?
Paramedic does, yeah. I mean, that's their training. Their training, they need to be knowledgeable in what facility is appropriate to bring that patient to, and
They'd be in consultation with an EM doctor?
so every single call we go on requires them to call into medical control. So every single call our crews do. If they go and do to someone's house and they're not injured, we have to call in and clear that scene with the, I don't want to say the physician, but we call into MRCC, the Medical Resource Control Center, on every call we go on. And so basically it is cleared by a physician, because they have the authority of the physician to do that.
I hadn't heard that term before. Is that located at Lakeview then?
Nope, it's at Regions Hospital. Every single ambulance service that transport within East Metro calls into the MRCC when they're doing a transport. So they would call and say, we're 10 minutes away from Regions Hospital with this patient, and that way the hospital gets a heads up to it. What we use MRCC for is they are our quality assurance. So they are assuring that the medics are following their protocols. They are the eyes and ears of the doctor. And if the crew has any question or they feel that we need to get a doctor on the line, that's who makes that decision. So every call we do goes through the MRCC.
Do we need any change of language here?
I just wanted to I don't think so, but I just wanted to confirm the paramedic can overrule about getting to the closest healthcare facility, inclement weather, or
Right, so we
at
do.
the paramedic call?
Yep, again, so when there is inclement weather and we make the decision, which we're probably one of the few services that don't follow the metro area, so when the roads start to get really bad, everybody goes on closest hospital divert. That message is sent out through the MRCC. So Health East is on closest hospital divert, North is on closest hospital divert. And as it, you know, because the weather might be different out here than it is there. But for us, it's hard for that to apply to us. And when I say us, I'm talking about really any of the services out in this area. If Hudson Hospital has a critical patient that needs to get to a higher level of care because they can't care for them there, somebody's got to do that. And the helicopters aren't going to fly in inclement weather. So do we have the authority to say it absolutely is 100% not safe to go? Yes. And we have done that before. But when it's life or death, we will do what we can to get them to that higher level of care. So we do have the authority to do that, but you're doing that in the best interest of the patient, safety, and safety for your crews.
All right.
Thank you.
I got a suggestion for a word change. Is that all sick or injured persons choosing transport as opposed to requesting transport? Requesting seems to put the onus on them, and I'm just unfamiliar with the, I now understand the procedures, but
I would guess that was Carl's language that went in that, and there must be a
Yeah.
reason for that.
I can check,
yeah,
I mean,
figure that out, but
I don't.
I'm trying to
think it
soften that a
makes
little
huge-
bit and make it more, you have a definite interchange
So
that goes
you're-
on around that.
You're working on that one.
Yeah, if you're leaving it to Carl, that
Yeah,
one.
the
Between
requesting,
requesting versus choosing.
yeah.
And
Okay. 15.1, the term. I think there was anything else.
there was just, and this is in the next to the last line, 1 year prior to the end of the initial term and each consecutive term. That's going to apply. Notice.
Oh, so at the end of the initial term and each consecutive term?
Yeah, or each, if it's automatically renewed, we
Right.
still, and somewhere down the road, beyond the initial term, we still give the 1 year notice.
Good with that?
Moving on.
15.2. I think we're good with A.
Yeah, B, and maybe this is a Carl thing. I read this as you get 6 months to cure the default, and if it's not cured within 6 months, you can use the dispute resolution
Or,
procedure.
yeah. Or may elect to use dispute
Yeah,
resolution.
or, right,
Okay, we're good.
yep.
C, No change there?
Nope, I don't,
D, on the fourth line, 2,
Yeah.
3, 4, after to another, insert nonprofit.
Nonprofit entity?
I don't have anything for the rest of the page. Anybody?
No.
Page 9, I don't have anything. So we move to page 10, at the top, 18.1, there are some issues, concerns.
yeah, on the exclusive, nothing with the exclusive provider so much as the next sentence, will not directly or indirectly plan, organize, provide, solicit, that whole thing. Well, if there's some consideration of non-renewing, we have to at least plan with, for that. So it would at least need to be, not apply within the 1-year notice period and maybe a little, actually, something like that. But at a minimum, within the 1-year notice period, we obviously would need to plan.
Okay, that makes sense. I think that's a Carl and Kathy
Yeah,
thing, but
okay.
I'll call it out for Carl. I don't
Okay.
know why that would be a problem.
Anything else on 18.1?
There was a
Does
suggestion.
I don't
it say
think
that at the bottom, the 1-year term is at the
Well,
bottom?
that's a non-solicitation, and that actually, I think should be separate, and I can talk about it with Carl.
Okay.
That for 1 year after the contract's terminated, neither party nor its affiliates may solicit or hire for employment any of the personnel, provider, or management personnel of the other party.
Okay, so it's separate, yeah.
So I guess one thing we discussed in the committee was, you indicated, at least if we go forward with this contract, any of our people can apply.
Yeah, but this
Yeah.
wouldn't apply to that, right?
No, this is,
That's after termination
Yeah,
of the
that's,
contract.
that's right.
Yeah,
Yep.
so that's following.
Yep.
Yep.
Anything else?
I think just the 1 year bit.
All right, 18.2, line 4, after disclosure, strike to comply with the requirements of applicable law. And I don't have anything else for the rest of the page. Anybody? I don't have anything else on 11. There were a couple suggestions that Bill had at the very end.
Oh, yes. What are Lakeview's intentions or expectations with respect to using the fire department as support in answering medical calls? And
Lift assists, car accidents.
for sure that they go on all car accidents today. We would expect that they would still do that. Our recommendation, and this is always from the medical directors and the changes in cardiac arrest management, we would ask that the fire department respond on cardiac arrest.
All cardiac arrests?
Yep. And I think when 2.5 years ago, when we looked at the numbers, that was about 25, I think, in the fire district that Hudson Fire responds to.
Okay, so concern here is the communities which you serve currently have staffed fire departments, duty crews and beyond. We do not have a duty crew.
Right.
Right? So that response could potentially be a firefighter on call, going to our fire department, hopping in a truck, then getting to the cardiac, which could be, 8 to 10 minutes, so.
Yeah, so I just want to for clarification purposes, it's not intended to be a first responder. It's intended to help manage the cardiac arrest itself.
Okay.
So in the new standards of CPR and some of the new equipment, you need to be changing personnel out every 2 minutes of CPR. So we need that manpower to perform the best care for the cardiac arrest victim. You need multiple people there to swap out CPR.
Okay.
You know, we have machines now that you hook up to, but
What
in
you're
the-
saying is they're not intended to be there first.
no, they're not intended to be there
to
first.
support.
It's to be a support to that
Understood.
incident.
Okay. Are there any other, what about lift assists? Is the expectation to?
Well, there's going to be cases out there that are beyond the ability of 2 or 3 paramedics to lift someone. We might need a whole fire crew to lift someone. So there will be situations where you need to call the fire department out to help with that. I don't have a number for that. It's
Sure.
It's a small number. I'm trying to give you some examples.
It's
You
the
know,
weight of
some-
the person if that,
Yeah,
Right.
you know, let's just say someone's on a boat that is incapacitated and they need to be extricated off a boat. We could certainly go down there and do that, but boats move, the docks move. For the best safety of the patient, you might want to have the fire department there. I'm just thinking of different examples where you might need them there. Again, it's for safety of the patient and the responders.
So it'd be almost as requested, when they
Yeah.
got on scene, you would say, start and make
Right.
that assessment and then
Right.
request the support.
You know, it's not that they would be automatically sent there. You know, the fire department gets paged out to Willow River State Park on everything. That was not our request, but,
Our fire department? does?
yes.
Yeah.
And I was told the reason is because there's a lot of situations out there that you need the fire department at. So those were decisions made long before we ever came around.
gotcha.
Well, they do the ropes rescue now anyway, don't they?
Yeah,
They didn't- The fire department does the
Fire
ropes
department,
rescue, I believe.
Yeah.
So-
It used to be the EMS, but
yeah,
Lift assists as needed?
as needed.
Because I'm just thinking that we should probably have some
a
verbiage.
provision in there on
Right.
expectations.
Just
or-
expectations, because as we look at it, this is, EMS is currently a department within the city.
Right.
What then repercussions on the fire department, or what is the expectations? I think outlining that now gives us better visibility to what needs to happen. Anything else? Cardiac arrests, car accidents, lift assist is needed?
You know, unusual rescues, someone
Okay.
having a heart attack on the roof, a roofer up on a roof. We need the fire department to come out with their bucket and pull them off the roof. I mean, those are things that, you can't put a number on how
I
many
get it.
times that would happen.
I get it.
Yeah.
So I think if you say unusual rescue
Sure.
situations,
Okay. And as we're sitting here talking, and please forgive me, back to 2.3, structure fire standby coverage. I forgot to bring this up. Lakeview EMS will provide coverage for structure fires within the city of Hudson. Can we change city of Hudson to entire fire department service area?
we can, that's our plan anyways, but
Sure,
yeah,
I
that-
assume that,
Yeah.
but we delineated city there, and I'm like,
Right.
well,
That's
Yep.
good.
Do we have multiple, just for my clarification, within the municipalities currently? They're all served by the city of Hudson Fire, right?
correct,
So there is no exception as it exists today in this footprint.
correct.
So instead of city and any participating municipality, it's,
It's
we serve
within the
Troy?
fire department service area, portions of Troy.
oh,
City of Hudson Fire District or whatever?
fire department service area.
Or, yeah, fire district.
Yeah.
Okay.
Don, could the cardiac support staff come from our police department as opposed to the fire? Or does it have to be fire?
It does and it can. I mean, in the cardiac arrest, again, that's why, a lot of police departments are carrying the AEDs and getting
Right.
out there first, and it certainly can.
I know our police have the AEDs, so that's kind
Right.
of why I'm asking. I think they do some of that regularly, so.
Yeah.
Kind of as first responders.
I think it's more the manpower of
Right.
of what's going on there. We're gonna be using some new equipment that's state-of-the-art equipment, and we're gonna do some training in June with that, and we're gonna roll it out in July. And it's gonna be there's 2 other places in the United States doing it right now, but there's a specific protocol based on cardiac arrest science on it. So we're gonna be doing training with our first responders on how to use this equipment, and there's procedures on how it happens. So having the fire department as part of those cardiac arrests are probably, we're gonna see our best outcomes. Can we do it without them? We can.
Right.
But I think as a city and as leaders of the city, I think at a minimum, for that type of medical type call, the proof is in the research that goes into it, and that is having the best response. So,
Thank you.
And we would include our first responders over here in that training.
absolutely, yeah.
All right, anything else? Okay, so, for purposes of moving forward, I am going to move that the following items in the contract language that we have before us be moved into the contract that will be our working document for, to be sent on to the council. And anything that's not mentioned here will be worked on between Kathy and Carl, and you guys, I guess, weighing in as well. So, follow along. Under recitals, I'm moving items B, D, E, F, under provisions of EMS services, 1.1, 1.2, vehicles and staffing, 2.1, 2.2, sub A and sub B,
Hold on.
okay?
2.1B, you're assuming the after release by the incident commander?
Yeah, I
Language
thought
added.
that you were going to be doing language on B and,
Yeah.
yeah. Right.
Okay.
Oh, I'm sorry, I didn't circle 1 there, did I? 2.1A and not B.
Oh,
Okay.
not,
No, I thought that there was language.
yeah,
gonna be
there is
redone.
language
Yeah.
in B to be added.
So, under staffing again, 2.2A and B. 2.3 needs to be worked on. 3.1 with the deletion.
Of the last sentence.
Yep. Insert anticipated completion date. 3.2. Under deployment, 4.1. And then we move down to continual evaluation of resource allocation, 6.1. Possible regional provision of EMS services, 7.1, 7.2. Under first responders, 8.3, 8.4. Regulatory compliance, 9.1, A, B, and C. 10, mutual aid, 10.1. 11, what did we do with 11.1?
That was just having the,
The word additional before participating municipality?
but also the language regarding the municipality deciding how to appoint and remove its
I
representatives.
won't move that, I'll let you guys figure that
Okay.
out, okay?
Plus the addition of the county.
And the
11
county, yep.
Right, 11.2, did we do, yeah, there's some language under 11.2, right?
Yeah.
So I'm gonna leave
Yeah.
that alone as well. 11.4, 11.5, 11.6, 11.7, 11.8, 12.1, 12.2, 12.3A, C, and D, 12.4, 12.5, 13.1, 15.1, I think there's language there, isn't there?
Yeah, there is.
Okay. 15.2A. Is there clarification on B?
No, I think we're
No, I
good
think
on
we're
D.
Okay. 15.2B, 15.2C. On D, are we okay with that, you guys? Can we just put nonprofit in there? Do you think that's an issue?
I don't think it's an issue,
Well, do you want it confirmed with
but
Carl?
I have Carl on that. That'll
All
be
right,
a quick,
we'll leave that
that'll be a
alone.
quick
We'll
hit.
leave it alone. 16.1, 16.2, 16.3A, B, C, D, E, F, G, H, I. 16.4, 16.5, 17.1, 17.2, A, B, and C, 17.3, 17.4, 18.3, 18.4, 18.5, 18.6, 18.7, 18.8, 18.9, 18.10, 18.11, 18.12, 18.13, 18.14, 18.15, 18.16, 18.17, and 18.18. Is there a second to the motion?
Second.
Got a motion, a second, discussion. Hearing none, all those in favor?
Aye.
Opposed? Motion's approved. These will be included in the contract, and we will set another date and time where we can all get together again and spend a nice long evening perhaps, or unless, if it rains Sunday, it's gonna rain Monday.
No, it's not.
But we'll get something out. Hopefully we'll get together next week, and that will give Carl and Kathy time to clean up the rest of this language.
So I would offer, not that I don't want to meet with you all again, but if we can get most of this language as stated approved in there, does it require another meeting?
Yes, we would have to approve it to send it to the council,
Gotcha. All right.
okay?
Perfect.
So, yeah, but you may not have to be here.
Yeah, we'll see.
Yeah.
But John doesn't.
All right, we got a motion to adjourn.
Hold to adjourn.
Second.
Motion and second to adjourn. All those in favor?
Aye.
Opposed? Motion's approved, and thank you, everybody, for hanging in there for a nice, long night.